Time to ask the doctor, and Mickey and I know this all too well. We get older, things start to break down, don't they? And you tell the doctor, every time I do this, you know, my elbow hurts. And he says, don't do this anymore. Yeah. All right, so thanks.
I think that's just you. That doesn't
thank
really
you for the support
bother me.
there, yeah. All right, so joining us this morning to talk about some of the problems you can run into, Dr. Robert Lolley. He's an orthopedic surgeon with Precision Sports Medicine this morning. Good to see you, doctor.
Good morning.
Yeah, and we do know that, you know, a lot of people like to be active. And sometimes when it's colder, they even get more active, whether it's indoors playing hoops or things like that. And you can run into problems. So let's talk about, first of all, ways that we can, you know, what's a major problem, what's a minor problem. And let's start first with minor problems that can happen and how you can try to deal with those, you know, if you're a weekend warrior.
It's very common as the weather gets cold, and especially like yesterday when it was damp. When you resume walking and activities following periods of rest, your joints can ache and be stiff. Simple activities, walking programs will help to loosen up joints and keep them more supple. And when you need a little bit more, some Tylenol or Advil, if the doctor says you can take those, can be very helpful.
Has there been conflicting information on ice? Because maybe people misuse it in terms of not only how much they put on, but what body parts they put it on, right?
Typically, if you want to put ice on an affected area, it should be a joint, whereas if you have a muscle group like your low back, heat can be more helpful there.
You know, and a lot of people may say, well, you know, my knee's kind of tricky. It's bothering me after I go for a walk or I go for a jog. When does it get to the point where they say, you know, you maybe ought to go see an orthopedist?
If the pain doesn't go away after just a few minutes or a few steps, and especially if it's associated with swelling, popping, clicking, giving way, if it's interfering with your activities of daily living, it's time to seek some medical attention.
Now, is it just true that as we get older, things are going to really start to hurt, you know, and should we scale back, like in terms of high impact, low impact exercises?
Yes, it's like the old engine that's hard to crank on a cold day. Your joints, as we age, tend to require more rest, but still some walking programs, things like that, but avoid the high impact activities.
All right, and let me ask you this too, because there's also people, physical therapists and trainers who will say, well, you should definitely try to walk or do a little short jog, jumping jacks before you stretch.
Absolutely, especially in cold weather.
Not the vice versa then, because you know the old thing was a static stretch first, and then you go for your thing. But what does the research show now?
Well, the cold weather tends to cause the muscles and tendons to be tight, and it's good to loosen them up with the walking program first, and then stretch.
All right. And what about our nerves, and especially when it gets cold, some of the sensitive conditions we can feel?
Well, you know how it is. If you hit your finger with something hard on a cold day, it's going to hurt more than it would on a warm day.
Right.
So, yeah, you can be more sensitive to pain.
All right. In terms of equipment, like our shoes, what should we look for to also maybe not only alleviate pain, but maybe also prevent some issues happening?
Well, we have to be careful when it gets icy out. Nice shoes that have a good grip will be very helpful, especially for older patients who can break bones very easily. So it's very important.
All right. Well, Dr. Lolley, some good information this morning. So if you're out moving around, apply some of that advice to help yourself out and keep you from having to go to the doctor's office, although that is good for business.
Yes.
All right, Dr. Lolley, thank you so much.
Thank you. Pleasure to see you.
All right.